Okay, so as Anna mentioned, I'll be talking about wearable technology today and how it relates to sleep tracking. And before I begin, I must explain that I'm also an employee of the U.S. government. So this work represents my own research, my own conclusions. So this does not necessarily reflect the policy or position of any government entity from the United States. So as an outline for today, I'll be breaking my talk into three main sections. So the first, I'll just be providing a brief background on sleep tracking technology. Second, and this will be the main section, I'll be reviewing results from three distinct studies that we've done where my lab has tested the performance of sleep tracking wearable devices. So this is broken down into an initial study where we took devices, measured them against what's considered the gold standard in polysomnography or PSG, and we did this in lab. Second, we took devices in people's homes to measure ad lib sleep for overnight sleep. And then third, we took those same set of devices and then tested how people who sleep during the daytime or nap during the daytime, how devices perform for that, which has not really been explored in most wearable performance studies. And then third, I'll wrap up with some conclusions and then discuss some of the potential uses of wearable sleep trackers and future research directions for my own lab. So as some background, I'm sure it's no surprise to anybody that there's been lots of advances in biosensor technology, and combined with a high consumer demand has led to a large market for wearable sleep tracking devices, but wearable devices in general that measure all sorts of physiology and behavior. It seems that there's about dozens of new commercial devices that are released on the market every year. And this is a market that now is estimated to be worth in the billions of dollars, and it's continuing to grow, both in the number of devices, the types of devices that there are, and just the market value of what this is. So I expect that we're going to continue to see year after year that this is going to be something that's growing and introducing itself more into the type of research that we do. Many devices in recent studies, including my own, but there's been dozens of other studies that have looked at the validation performance of devices, have found that most devices do perform relatively well in studies when we compare them to standard methods of sleep measurement. So this would be against PSG, Actigraphy, sleep diary, and I won't be discussing results from many other studies, but you can look in the literature and find that, like, if you are interested in a certain device, it's likely that somebody has done some kind of study on it. However, devices are released onto the market before there's a peer-reviewed study. So often people are using a device before we understand its limitations or strengths in terms of sleep tracking. And we do find that devices show promise for overcoming many barriers to measurement of sleep outside the lab or clinic. And so this is a huge positive, I think, for the sleep field in general, that there are alternative methods now where we could be measuring markers that we would traditionally only prescribe to the lab or clinic. And some of the barriers that it overcomes is that these are lower cost devices when you compare them to PSG or actigraphy methods, let alone being able to measure people's sleep more naturally in the home environment versus having them to come in and staff overnight sleep studies. Many of these devices are made to be comfortable. They're sold on the consumer market. So the design and the comfort of the devices, as well as the ease of use, are sort of maximized. The data is gathered passively. So the user just wears it. And usually in the morning after wearing it, you sync it with the device and it is just passively recording the data. And then in the morning, the data and the report about sleep is there for you. And it also lends itself well to longitudinal sleep tracking because people tend to buy these devices as an investment and they wear them for weeks, months, sometimes years. So there is a capability here to look at longitudinal data with these types of devices. And then for my own research, because I do work with operational military forces, these could present a tool for us to use in operational populations where sleep measurement, especially objective sleep measurement, has been lacking over time. And there's been strong interest from clinicians, researchers, and professional societies within the sleep field as to how these devices perform, as well as standardizing some of the methods for their evaluation and use. The American Academy of Sleep Medicine, so this is the major clinical sleep group in the United States, has published multiple position statements cited here as to the state of wearable devices, as well as the recommended use of them. And even the Sleep Research Society has published a very good review paper, and also proposed consensus guidelines for how to conduct and report studies that test wearable sleep tracking devices. And also of note, there was a recent paper in the Sleep Health Journal by a consensus group that discussed an important feature of studies that purport to measure validation. So validation, it's kind of a debated term, and this is because people find a paper that will say, oh, validation of device X, and then believe that that means it is validated. However, validation is more of a process, and rather than that term of validation that has a lot of baggage with it, it's preferred to use the word performance evaluation, which I'll be using today. So there is validation is part of that process, but really we are looking at the performance of how these devices do in measuring sleep. And it's been proposed that the evaluating devices, or this validation process, is really multiple steps. So initially you want to establish the baseline performance for these devices. So this is why most studies have been done with a control healthy population, usually of young adults, usually in a sleep lab, and usually against polysomnography or PSG. If a device can perform well under these types of control conditions, then it might lend itself to further testing under less rigorous standards, such as in the home. So you might want to then introduce this outside of the lab or the clinic, and then you can compare this at home to, it could be home PSG or EEG and actigraphy methods. So these are, and then you can also, if you are interested within a certain population, you want to also see how that device performs within that population, because a lot of people are working with clinical or operational subpopulations. It is often not the case that these devices are actually tested within that population as an initial study. So you might find that there is a study of a certain wearable device that you're interested in, but it's only within a very healthy young cohort. But if you're interested in measuring the sleep of older adults, teens, folks with insomnia, other sleep disorders, then you're probably not going to find a direct study that has tested within that certain population. And so you might want to find, for reference, whatever it is that the best study that matches the methods of the population that you are studying in terms of to match that, in terms of guiding you to use a certain device. So it really is a multi-step process. If you have a device, you want to see that ideally that there are multiple studies in different settings and populations that it's been tested against. And before I get into my own data, I really want to highlight here where we are in terms of just typical measurement of sleep in the home environment with what is the common method of actigraphy. So risk-based actigraphy, and there's many different research-based models out there that have been used for decades. And this is an established method, and it has been quote unquote validated as well. But it comes with many limitations, and these are limitations that the field basically has accepted over time. But I think sometimes people need a reminder that these limitations exist. And so if we're going to look at wearable devices that are often also worn on the wrist, it's a good benchmark for performance to understand the performance of new devices in context of what we already accept for actigraphy. So this is a plot on the right by Marino and colleagues published in 2013 that looked at different studies over time that used actigraphy devices and compared it with polysomnography, or what we consider the gold standard. And this is a density plot of epoch by epoch, sensitivity, specificity, and overall accuracy. So this is, so when we look at sensitivity, this is the true positive rate for correctly detecting epochs of sleep. So you could think of this as the sleep accuracy for the device. And this is shown in the blue over here. And then on the opposite side, we have the specificity, which is the true positive rate for the actigraphy device to correctly detect a wake epoch. And this is represented by the red curve over here. And what we see is that nearly all studies of actigraphy devices already perform at a very high level for detecting sleep. This is over 90%. So it's going to, if you are asleep, it is very likely that an actigraphy device is going to appropriately classify any given epoch as sleep. However, if you are interested in understanding how much wake somebody had, so if you are interested in measures like sleep onset latency or WASO or sleep efficiency, then actigraphy devices already perform rather poorly. There's low to basically medium performance, but they never get above roughly 60% accuracy within this. So we already accept that this is what actigraphy does. It's going to already miss a lot of the wake that occurs during sleep when you are using this established research method. So, so my studies that I'll be showing in the next slides, we compared new wearable devices against the standard method, but also against standard actigraphy with the ActiWatch, so that way we can understand this is the major limitation of actigraphy already. Can a new wearable device basically perform as good or potentially better than what we already accept from actigraphy methods? So again, the 3 studies that I performed were first an in-lab sleep performance validation of 7 different devices conducted against polysomnography. The second one, we took a set of 4 devices and had people use them at home over a week against mobile EEG. And then in the third, we looked at how devices performed for tracking daytime sleep or naps, which is really kind of new territory for looking at how wearable devices perform. So in study 1, we published this in the Sleep Journal in 2021. So this is the in-lab PSG validation study. The participants were 34 healthy young adults, ages 18 to 35. These were folks with no sleep disorders. They weren't using any medications. They were on a regular 8-hour sleep schedule before the sleep study. We put them on this schedule for 4 nights before they came in for the first night of in-lab testing. They were tested for 3 consecutive in-lab nights against polysomnography for exactly 8 hours of time in bed. And then we tested PSG against actigraphy, as well as a set of commercial devices on each night. So the 7 devices that we tested here were a combination of wearable devices and non-wearable devices. And I also should mention that not every participant wore each device on every night. So we kind of used different subsets because it was not feasible to test every device on the same night on the same person, because the signals might interfere. We wouldn't be able to collect the data in an accurate way. So in combination, the overall wearable devices that we tested were the Fatigue Science Ready Band, a Fitbit Alta HR, 2 different Garmin models. So one is a more expensive like running version. The other one is just a fitness band. But when we also tested 3 different non-wearable devices. So the first was the Early Sense Live, which this red arrow is pointing to here. So it's a disc that you put under your mattress. There's various devices like this on the market that either go over or under the mattress. This is one that we used at the time that goes under the mattress to detect your body signals. And then we also tested 2 non-wearable bedside devices. So first the ResMed S Plus, which now the updated model of this is the Sleep Score Max, which we then tested as well. So this is something you plug in, use an app to start and stop the recording, but it is on your bedside table and basically uses like a sonar signal to pick up your body signals to then make a representation of your sleep. And so with our data analysis, we looked at epoch by epoch agreement, so that sensitivity and specificity measures that I showed earlier. So we performed that type of analysis. And then to look at sleep summary measures, we looked at what the standard way of looking at is with Bland-Altman plots. So I'll be showing a number of those. We looked at total sleep time. So this is comparing the bias in total sleep time against PSG. We also looked at how well these devices picked up different stages of sleep. Not all wearable devices measure sleep state or produce outputs of sleep stages, but for the ones that did, we performed that analysis. And like I mentioned, we also had everybody wear a research grade wrist actigraphy watch for direct comparison. So in this case, we use the ActiWatch 2 by Philips. So the main epic by epic results here for sensitivity and specificity. So again, sensitivity is its ability, it's its weight, is its sleep accuracy. So how often did actual epochs of sleep, how often did the wearable pick those up? So we could see that just like in the figure before, it is not surprising that we had over 90% sensitivity for each of the devices. So this is with the ActiWatch, as well as all the different commercial wearable devices. So if you are asleep, basically every device is really good at telling you that you are asleep during that time. But then when we looked at the specificity, so this is the wake accuracy, or how often a given epoch of wake was correctly classified by that device. If we look in the top line, this is right in line with that prior paper where we found that only a 39% specificity existed for the research grade ActiWatch device. So this was sort of our benchmark for performance for the different wearable devices. And what we can see is that with nearly all devices, they not only met that 39% benchmark for performance, but exceeded it. So we have even two of the wearable devices, the ReadyBand and the Fitbit, that were over 40% and 50%. And then the three non-wearable devices also met specificity levels that were higher than the ActiWatch. So these told us that in terms of epoch by epoch sensitivity and specificity, that wearable devices overall were pretty good at detecting these. However, I must point out in the middle here that the two different Garmin devices that we measured actually had very low specificity of only 18 and 19%. So this is roughly half of that of the ActiWatch. So one of the interesting findings from this study was that it looks like the algorithm for Garmin devices is actually very non-specific. So it's really great at telling you if you're asleep, but not if you are awake during the episode. And we found that it was pretty good at detecting sleep onset latency period, but it was lacking more on the WASO side. So every time somebody woke up throughout the night, it was unlikely to classify that wake correctly. And then when we looked at sleep stages, so this is a subset of devices that actually output the sleep stages, we found that sensitivity and specificity levels were more moderate. So for it to correctly classify light sleep, we found that it was roughly good about 50 to 70% of the time, but for deep sleep and REM sleep, it's operating about chance or a bit higher than this. And then for specificity, it's how good it's telling you that it's something other than that sleep stage. So we do find that it's a bit higher in those cases, but overall, what I gather from these numbers is that the individual sleep stage detection by any given device is operating about chance or a little bit higher. So if you are looking to use wearable devices to measure deep sleep, for instance, just know that it is a low sensitivity for even correctly detecting the epochs of deep sleep that do exist, and it's more likely to correctly detect that it is something other than deep sleep. So I would not necessarily suggest that wearables are at a high performance level for correctly detecting individual stages of sleep at this point. So these are the Bland-Altman plots. They are, so this is across all of the devices that we tested, including ActiWatch here on the top left. So the way to read this is that on the x-axis is the mean of the measurements. So this is the mean of the PSG and the given device. And then on the y-axis is the difference between the device and PSG. So there's a zero line in the middle, which is in bold, and any positive numbers indicate an overestimate by the device compared with PSG, negative numbers an underestimate. So what we find is similar to actigraphy with the ActiWatch here on the top left, is that these devices are more likely to overestimate sleep than wake. So since everybody had a time in bed of 480 minutes, if you had a lower mean sleep, then because the individual nights were above the zero line, that indicates that that they are more likely to be biased towards overestimating sleep at the expense of correctly detecting wake. And this is reflected in the sensitivity and specificity numbers that we saw that I showed previously. But overall, if you had more sleep in your sleep episode, so a higher total sleep time, we did find that it clustered around the 0 line. So if you are a good sleeper with little WASO throughout the night, it is likely to be pretty accurate for correctly detecting your overall total sleep time, which is pretty encouraging and also matches the performance of the ActiWatch shown here on the top left, and in some cases may even be preferable. And in terms of the sleep stages, first representing light sleep, what we see is, unlike in the previous one, that across the amount of light sleep that you have, there's a good chance that it will either overestimate or underestimate your amount of light sleep that you have. And I should say that with light sleep, that is typically for wearables, they combine stages non-REM stage 1 and 2 together into one stage called light sleep. So we did find that there's more variability across the y-axis for light sleep, but this was also the case for deep sleep and REM sleep. So this also indicates to me that if you are using a given wearable device, there's a good chance that it could under or overestimate your amount of REM sleep or deep sleep by even an hour on a given night, and it doesn't really cluster as much around the 0 line. So this is further indication that wearable devices are not necessarily that accurate at measuring the amount of light, deep, or REM sleep at this time. So getting into study number 2, so this is where we used a set of devices at home. So previously that was in the lab under control conditions. So this I published in the Nature and Science of Sleep journal in 2022. So very similar methods. We had, in this case, 21 young healthy participants. The testing protocol was that they actually self-selected their sleep. So this was completely ad lib sleep at home. That was for 1 week at a time. So they wore a set of 4 commercial wearable devices, as well as the Actigraphy watch and a mobile EEG headband on every night. So in this study, every participant did use all devices on every night. And then for a comparison with the time in bed, we had them complete a daily sleep diary to report their bed and wake times that we used as a reference as well. So in this case, in this study, the set of devices that we tested were the Fatigue Science Ready Band, which was also used in the lab study. Also, we used the Oura Ring, which has become a very popular sleep tracking wearable device. There's also other ring-based sensors that are on the market now. We used another Fitbit device, similar to the one that we used in the previous study. This is the Inspire HR. And then we use another more expensive running watch, this one by the company Polar. This is the Vantage V Titan device. And then this was compared with, again, the Philips ActiWatch 2. And then for home sleep, instead of doing a full PSG hookup, we use the Dream 2 research version of, this is a mobile EEG headband device that has a good validation against PSG. So that's just worn on the head. It has multiple EEG sensors, and then it also produces a report about your sleep. But since it's worn on the head and measuring actual EEG, we use that as a research standard for the sleep measures. So again, we did epic by epic agreement statistics of sensitivity and specificity. And then the Bland-Altman plots to look at time in bed, total sleep time, sleep efficiency, and then the sleep stages. And again, we use the Actigraphy device for direct comparison. So similar to before, we found that sensitivity levels were above 90% across all devices, which was unsurprising. And again, similar to our previous study. So again, these devices are really good at telling you if you're asleep, that you are asleep. And on the specificity side, the levels are, again, low to moderate, with the ActiWatch only about a 35% specificity rate. Similar, but a little lower than our lab study. And what we found is that the first 3 commercial devices here, the Ready Band, the Fitbit Inspire, and the Oura Ring, had at least 5 to 10% better specificity. So in that weakness point of specificity, most of the wearables in this case, again, were outperforming the research standard ActiWatch. However, the Polar Vantage V Titan only was equal to that. So in this case, all of these devices were at least as good as the ActiWatch in detecting wake epochs correctly. And then for light, deep, and REM sleep, we have very similar numbers to what we found in the previous lab study. So again, these are at more of a moderate level for correctly classifying any of the individual sleep stages. So most of the time that a device gets a sleep stage wrong, it's getting it wrong with light sleep, which is indicated by a low specificity here. So there's a lot of confusion and guesswork, I think, by some of the devices in terms of classifying individual sleep stages versus overall just sleep and wake. With Bland-Altman plots, since time in bed here was ad lib, we actually looked at time in bed as one of our main metrics in this study, because if a device can appropriately measure and detect what your bedtime and wake time was, and then do a sleep recording within that window, that is I think a large benefit of using wearable devices, because I think, as most people know, when you're using actigraphy methods and you're going in, you have to post-process the data, and usually the actigraphy algorithm is not automatically detecting the time in bed window appropriately, and then a researcher has to go in and like tune it to mark the appropriate start and end of each sleep period. So if wearable devices can automatically detect the start and stop appropriately for the sleep window with the time in bed, then it has a good chance of at least getting most of the overall sleep metrics correctly. And that is what we find here, that across the 4 different wearable devices, we found that in terms of time in bed, there is a large cluster, which can also be seen on the gray density plots on the right side of each of the plots here, that nearly all nights, that each of the wearable devices correctly detected time in bed with very low bias. But I do want to point out across each device that sometimes there was a bias of multiple hours. So it is important, if you're looking at these devices, that you necessarily should not trust that the time in bed window is correct. And sometimes there is a way to go into the app associated with the wearable device, or you can post-process, if you have an export of that data, to then correctly move the time in bed window and then run the analysis through there as if you were to use it as an actigraphy device. So I would say that if you are using wearable devices, if you can, I would highly encourage looking at the time in bed before looking at the other sleep metrics, because roughly 5 to 10% of the time, it could be wrong, and it could be biased over or underestimated, usually overestimated in our case with these wearables. But this would vastly improve, I think, the outcomes that you would get from the sleep tracking with these wearable devices. But encouraging that on almost every night, they were pretty accurate at telling you when you went to bed and woke up. With total sleep time, we find similar results here as the previous lab study, where across devices, including the ActiWatch, that there is a nearly zero bias with overall total sleep time, with most of the time there being an overestimate in total sleep, which again is corroborated by the higher sensitivity than specificity levels and in the prior study in the lab. So sometimes, but in some cases, it might even underestimate total sleep. So I think some of this can be fixed if the time in bed window is appropriately corrected in cases where it might be incorrect. But overall, on most nights, you will find that given a 30-minute limit of agreement, it's going to get total sleep time roughly correct. Here we plotted sleep efficiency. So regardless of the time in bed, we wanted to see, like, if you have more efficient sleep within that window, whether it is a 4-hour sleep window or an 8-hour sleep window, how often is it, how is the bias looking? And we could see a funnel pattern for each of these devices, including the ActiWatch. So again, like, if you have a higher sleep efficiency, which most healthy young adults, like those in our studies, did, then it will be roughly correct with a close to zero bias almost all of the time. But it's when you have more wake in the episode. So that's represented by lower sleep efficiency numbers going towards the left on each plot, that you do see this funnel pattern where a device might over or underestimate the sleep efficiency. So this also indicates to me that if you have more of an insomnia phenotype, that with more wake in the sleep episode, that it is more likely to be slightly incorrect in terms of the estimate of sleep efficiency, but that should also correspond to time in bed and total sleep time. And then when we look across sleep stages, so at home, we again find the same thing where there is a large scatter across the y-axis of bias in terms of the correct amount of light sleep that is detected. So again, this indicates to me that it is operating at chance for whether it could get the correct amount of any given sleep stage correctly. And this is across the 3 devices that measure sleep stages. Here it is for deep sleep. It's a little more clustered, but again, like there is considerable variability. So if deep sleep is something that you're interested in your study, I would not necessarily get that data from a wearable device. And then for REM sleep, similar pattern as well. So I'm highly encouraged that what we found in the lab and in the home environment were largely similar across different wearable devices. But this does help outline our understanding of the strengths and limitations of these types of devices. And then getting into study 3, where we looked at the same set of 4 commercial devices, but we instead recruited a group of shift workers who mainly had daytime sleep episodes. And we published this a few months ago in the Nature and Science of Sleep journal. So again, we recruited healthy young adults. And in this case, we found people who had an irregular sleep schedule. So they had to report sleeping for at least 1 hour between the hours of 6 a.m. and 10 p.m. at least twice weekly. So many of these people were having their main sleep episode during the day, but some of them also were people who napped regularly or who split their sleep. So some operational or shift workers sometimes will split their sleep between 1 or 2 or more episodes throughout the day. So we wanted to see, okay, let's really test these devices to see how well they pick up irregular sleep patterns, which really has not been looked at in many prior studies with newer wearable devices. So in this case, again, they had ad lib sleep for 1 week at home, and they had to have at least 2 or more daytime sleep episodes per person. They wore the same set of devices that I just presented in study 2, and they also completed a daily sleep diary, which we checked daily. So in this case, the main outcome was actually time in bed. Because we already published on the sleep wake and sleep stage performance results in the prior study, we mainly just looked to see, like, can the device correctly get the time in bed window for when you were sleeping during daytime hours. And indeed, we did find a similar pattern where there's a roughly 0 bias for most daytime sleep episodes across the 4 different devices. So when it does detect a daytime sleep, a nap, and it can appropriately get the time in bed correctly most of the time. However, you do see that there are some individual sleep episodes where it might under or overestimate the amount of sleep, sometimes by more than an hour. So again, I would conclude from this that if you are to use wearable devices, that you should look to make sure it's getting the time in bed window correct, because it is automatically processing this without a user going in like Actigraphy to appropriately tune the time in bed window, but most of the time it does get it roughly correct. And that's just across devices. And this is also almost irrespective of the amount of time in bed that you have, whether it's a nap episode or a longer full daytime sleep episode. And here was perhaps the most interesting part of the data that we found, where we noticed in the data that sometimes the devices would not pick up all of the daytime sleep episodes that we measured. So we knew when they were sleeping because they filled out a daily sleep diary. We checked on that daily, and we also have the corroborating evidence from the sleep log that they filled out daily. And if this is a histogram across time in bed, so these are on the left side of each one would be like what we would consider naps that are 0 to 1 hours in duration, 1 to 2 hours, 2 to 3, and then going towards more of the full length sleep episodes that many of these people would have during the day. If it is in green, that means that that daytime sleep episode was correctly detected by the wearable device. And if it's in red, that means that a daytime episode was reported, but was not correctly detected by the device. What we find is that the Fatigue Science Ready Band, Fitbit, Inspire HR, and the Oura Ring all had very few of these missing daytime sleep episodes. So most of the time it will appropriately find that you did sleep during the daytime within some limitations. However, we did find that when it missed it, it more often missed it with the nap episodes, so ones that were less than 1 or 2 hours of time in bed. And if you do look at the literature from each of these devices, some of them do mention that they do not pick up, they are not designed to pick up certain duration of naps. And I think that's to improve the accuracy of those wearables, because they are worn, or they are detecting sleep passively and automatically. They are likely to, they are afraid of making a mistake and overestimating how much sleep that you're having, and detecting naps that may not be there when you might just be sedentary. However, if you look at the Polar Vantage V Titan device, we actually found a whole lot of daytime episodes that it completely missed. So every episode that was under 4 hours in duration that occurred during the daytime, it missed, and it also missed a significant proportion of the fuller length sleep episodes. So one of the conclusions here is that maybe not all devices correctly detect daytime sleep episodes. We did find this to be the case for the Polar device, but it could be a feature of the algorithm design and not necessarily the sensors on the device itself. So the choices of the algorithm and the company are very important, I think, for whether or not it allows certain irregular sleep patterns to be detected. Because in the prior study, we did find that it detected nearly all of the nighttime sleep episodes just fine. So there could be something about its detection of daytime sleep that is lacking. So in conclusion, we found that across both lab and home settings, that most of the time, the devices perform quite well for sleep-wake tracking. However, there were certain nights with considerable variability, as I showed, especially in the Bland-Altman plots, where you can see large over or underestimations in any given sleep summary metric. And in general, we found that devices are better detecting sleep than wake epics, but this has been known in the actigraphy literature for decades. Wake detection for most devices, as I showed, was similar or maybe slightly greater than mobile standard methods. So in this case, that would be actigraphy. As mentioned from study number 1, we did find that Garmin devices were significantly worse at detecting wake than actigraphy, and compared with all the other commercial devices. So with that one, I would not suggest that as a high performance sleep tracker. And the non-wearable devices that we tested in study 1 also perform well in tracking sleep and wake. So this provides some options for people who don't necessarily want to wear a wearable device to sleep and more want to use their bedroom environment, the mattress, or the bedside as a way to track your sleep. All commercial devices that we found were, I would say, inconsistent at tracking individual sleep stages. So that is really shown by the variability across the y-axis on the Bland-Altman plots for light, deep, and REM sleep. So they might be better at just detecting overall sleep than wake, but not necessarily individual stages of sleep at this time. And then we also find that some devices, in this case, the Polar device that we tested, was inconsistent at tracking daytime sleep or naps. So that is something that if you are working with an operational population like I am, that you may want to consider that. You want to look in the literature to see which devices actually purport to measure these types of irregular sleep patterns. And I would strongly recommend that devices be used in combination with a different method that you trust and that has been used in the sleep field, such as the daily sleep diary or a different reference, even an actigraphy watch or something else, if you were, when possible, if you were using the newer type of wearable device in your research or even just for your personal tracking. And I think I would really stress that the most important thing to get correct is the time in bed, because these devices only, they perform passively and automatically as a feature. So this is a good thing for consumers because it's just really easy to use. But if it gets the time in bed window incorrect, such as if you're sedentary before you go to bed, if you're reading, if you're watching TV, then it might actually think that you went to sleep before you really did. And that could expand the overall time in bed window, which would make the other calculations of total sleep time, sleep efficiency, WASO, these would be incorrect. So if you can actually get the time in bed window to be correct, then you might have a better chance of getting an appropriate sleep-wake output. And as mentioned here, there is a potential to edit the time in bed within certain devices and apps. So I know Fitbit does this. So you can go in after the fact and change the bedtime and the wake time, and then it will reprocess the data. So this could improve your sleep data accuracy. And you can use this for your own tracking, or if you're doing a research study, and if you have a sleep diary like we do, then you could theoretically go in and improve the accuracy of that sleep data. So the data that I showed you were from studies where we recruited healthy young adults. So these findings are still best generalized to people with regular overnight sleep patterns. And nearly all of the studies that have been done, like mine, that are across the validation performance process, they only look at regular sleepers with overnight sleep. So unfortunately, if you are looking for a certain population or a setting to use your devices in, then across age groups, patients with sleep disorders, also if you're looking at shift workers with irregular sleep patterns like I am, or even military and operational populations, that you do want to find a study that may have already used devices in that setting. And so we are engaged in research to basically do that. So we are still looking to find which devices perform well across the lab, the home, and the field. And then we want to identify which devices we think perform quite well, that are also have a good user experience by our participants, and then use these in real world settings. And this can be applicable to military and non-military environments, but there has not been a lot of objective sleep tracking in military environments. And this is why we are engaged in this type of research, so we could identify which devices to then get daily measurements of sleep in operational settings where sleep is often an issue. And we're also looking to develop our own sleep algorithms. So we could potentially optimize their performance if we can use algorithms that we understand the inputs and the outputs from. So one of the limitations of these devices is that these are proprietary algorithms and proprietary devices. And at any given time, a company could just push out an update of the firmware or the software, and they could even change the parameters of the sleep algorithm without you necessarily knowing. And so that creates a black box problem where you sometimes don't understand at least where it's processing the data. And we know with Actigraphy what the parameters are. So that continues to be a limitation. But if we can use the data from wearables and then process it with our own algorithms, then potentially we could at least standardize the performance across studies. And I would leave you with this, that I think the current findings from my studies and then the wealth of other evaluation studies of devices have shown that most commercial devices actually could serve as good alternative sleep research or clinical tools, serving as an alternative to Actigraphy, because I showed, and many other studies have shown as well, that they perform at least as well, if not slightly better in many cases, on some of the primary outcomes of sleep and wake studies. And there are several advantages to this. They are lower cost devices than Actigraphy or PSG or EEG methods. They're probably easier. They have an easier setup. They're typically made to be quite comfortable because they're sold sometimes for hundreds of dollars on the consumer market. So they look pretty sleek. They're easy to use. They track sleep passively and automatically. So there's a lower barrier to entry for getting the data. And there's just like Actigraphy methods, you could actually look for longitudinal patterns in sleep. So with that, I'd like to acknowledge the Naval Health Research Center and the Sleep Tactical Efficiency and Endurance Laboratory fellow members. The principal investigator of the lab is Rachel Markwald, as well as research staff members, and our sponsor, the Office of Naval Research. These are the various references from the studies and my studies, as well as the other ones in the background that I presented. And with that, I'd be happy to take any questions.